Joe Biden's administration on Monday kicked off a 3-month emergency enrollment period on healthcare.Gov, the open healthcare coverage market born from Obamacare, as the pandemic resulted in thousands losing their health insurance. The market for subsidized health plans will remain open through May 15 as the Democratic-led Congress pushes for more financial help that could cut premiums. This enrollment period during the coronavirus pandemic is an early test of Biden's strategy to use the Affordable Care Act as a springboard toward health coverage. Healthcare is a right, not a privilege, and I will do everything in my power to ensure that all Americans have access to the quality, affordable health care they deserve, Biden said in a statement released. That is especially critical in the midst of a deadly pandemic that has already taken the lives of more than 470,000 of our fellow Americans and infected more than 1 out of every 12 additional Americans, often with devastating consequences. He continued, starting today and running through May 15, 2021, we are open for all Americans to have the opportunity to sign up for health insurance. Now, everyone will be able to use a special enrollment period to help secure some peace of mind as we work to beat the pandemic and strengthen and build on the Affordable Care Act. The 3-month period is a way for Biden to get around obstacles with the market being shut down while the 6-3 conservative majority Supreme Court decides the fate of the Obama-era healthcare program later this year. Advancing on a parallel track to the health coverage initiative, the new nearly $2 trillion COVID-19 relief bill from House Democrats would offer a generous, though temporary, increase in subsidies for people covered. But while policy experts are taking note, it's unclear how uninsured Americans will respond. Former President Barack Obama's health law has been on the books over a decade, but surveys consistently show that many people lacking job-based insurance do not realize they may qualify. The Congressional Budget Office estimates that about 33 million people are on it. The Biden administration is going the extra mile to try to sign up. People.HealthCare.gov will be accepting applications starting Monday through May 15. A period about twice as long as annual OP. The Centers for Medicare and Medicaid Services, which runs the program, has a $50 million advertising budget, 5 times what the Trump administration would spend on annual open enrollment. Under Biden, there will be a special emphasis on reaching Black and Latino communities that have borne a heavy burden from COVID. The emergency enrollment period was kick-started last month as Biden signed a series of executive orders and actions related to the prevailing. Across the country, people in the 36 states served by the federal healthcare.gov marketplace will be able to. Additionally, most states that run their own marketplaces are matching the federal effort, giving it the feel of a national campaign. The appeal for uninsured people could become much clearer if Congress increases premium subsidies as part of its next virus relief. By the Budget Center's calculations, a family of 4 making $50,000 would pay $67 a month in premiums for a standard plan, instead of an average of $252 currently, while also qualifying for help with deductibles and copay. The boost in premium assistance would be available for this year and for 2022. Similarly, a single person making $30,000 a year would pay $85 a month for a standard plan instead of the current $195. The Democratic proposal would allow more solid middle-class households to qualify for financial help. On the opposite end of the scale, those who've experienced unemployment would qualify for extra generous subsidies. Republicans who tried but failed to repeal the law under President Donald Trump are calling the Democratic plan a waste of taxpayer dollars. But many Democrats see it as merely a down payment on a more ambitious health care. The Obama health law now covers more than 20 million people through a combination of subsidized private plans and, in most states, expanded. Experts agree that job losses during the pandemic have led to more uninsured people, but it's unclear how many more. Some estimates range from 5 million to 10 million, while the Congressional Budget Office suggests a lower number, more like 3 million. Chris Sloan of the consulting firm Avalar Health says it's likely that many who became unemployed in the pandemic had no job-based health insurance to begin with. That means they represent the demographic for which the health law was originally designed. People are coming back into the workforce as the unemployment rate comes down, but they may not necessarily have the same job or as good a job, said Sloan. This will be an important option for people still facing job and employment insecurity.